Commissioner Gershenson.
Here.
Commissioner Erickson Gall.
Here.
Commissioner Taylor.
Here.
Commissioner Spiz.
Here.
Commissioner Cowell. Commissioner Gingell is absent with notice. Commissioner Luce.
Here,
You have quorum.
thank you. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes from October 21st. I have a motion by Commissioner Gershenson and support from Commissioner Spiz. All in favor say aye.
Aye.
Opposed? Our minutes are approved. We next approve the agenda. I have a motion from Commissioner Taylor and support from Commissioner Erickson Gall. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment. This is for items on the agenda. If there's anyone from the public wishing to comment, you would come to the end of the table, state your name and community, and you have 3 minutes to talk.
Is it for items on the agenda or is it for?
Items on the agenda, and at the end of the meeting, we have a public comment for any comment.
Thank you.
All right, seeing none, our first public comment is closed, and we move to our presentation from Common Ground. So I see many Common Ground people here, and I would invite you to come to the head of the table.
Well, thank you very much. Good morning, everyone. My name is Jeff Kapuscinski. I am the Chief External Relations Officer for Common Ground. This lady to my left needs no introduction. This is Heather Ray, the CEO of Common Ground. We're going to take a few minutes to talk to you about the transition that is currently in place or trying to take place in Oakland County
everyone.
crisis services for behavioral health. We believe that this issue.
Introduce everyone
I
that's here.
apologize, thank you. Cheryl, I was gonna say Ashley. Cheryl Rivas, Vicki Krigner, Ted Williamson, thank you, Kay White, Janet Sarkos, Lee Schultenover.
Board members.
Kay is a board member.
And the rest are executive leadership.
Thank you.
Thank you. So as I said, we're here really to do two things. Number one, to ask you to take a closer look at this issue. We believe there are parts of this that you all really need to understand for the benefit of our community, to pause this and take a closer look. Secondly, we want to correct some of the misinformation that has been put out about what's taking place at the crisis center or by the services provided by Common Ground. So in that regard, I'm going to start by handing out a couple of pieces of paper. The first one is two-sided, so if you would please pass those around. And then the second one is just one-sided. So I'm going to start by talking a little bit about the process. When someone is in crisis, there are many ways that they can receive help, and specifically receive help from Common Ground. Probably the most popular or common way that someone receives help that is in crisis is that they call the Resource and Crisis Hub. That is the 1-800 number that Common Ground has managed for many, many years in this community. When someone calls the Resource and Crisis Hub, 80% of the time, that individual's crisis can be resolved within that phone call. The other 20%, half of those folks will need a higher level of care, meaning that they probably need to come into the crisis center, or perhaps they need to go inpatient to an inpatient psychiatric unit. The other half of those folks generally will receive a visit from our mobile crisis teams that traverse the county to meet with people who are in crisis. The other way that people come to Common Ground is they come in through the front door, either through by themselves, with someone dropping them off, or through a police drop-off. That actually technically would be the back door. But we accept all of those folks. And for all of those folks, 70% of them have that crisis resolved within 24 hours. The remaining 30%, half of those folks will require a higher level of care, meaning that they are going to an inpatient psychiatric hospital typically. The other half still require a higher level of care, but those folks are staying within the Resource and Crisis Center at the Crisis Residential Unit, which is a program that we provide where folks can stay up to 2 weeks to recover from the crisis that they're suffering. So, yes, ma'am.
So the numbers you're giving now are out of the 20% that it's not the 80% that is helped by the phone call, it's the other 20, so you're breaking that 20 down.
That was for the phone, for the walk-ins or the police
Walk-ins,
drop-off.
okay.
It's 70% that are resolved within
Okay,
that first
I
24 hours, so it's the remaining 30%. Half of those go to the Crisis Residential Unit. The other half need that higher level of care, which is
Okay.
inpatient hospitalization.
Thank you for clarifying.
You're very, very welcome. So with that, I'm going to turn the second half of our presentation over to Heather Ray.
And the other piece of paper you have is some community impact data. Our work is really important for emergency departments where we have critical partners in the emergency departments really needing to focus on people that who have acute medical conditions where we can take care of those who have a psychiatric emergency. We have psychiatrists, nurses, behavioral health professionals such as mental health clinicians, behavioral health technicians, a host of other people working as a team throughout our service continuum. So it's a savings to our community by having a more specialized response to people as opposed to going to an emergency department when they don't need that. They need an emergency behavioral health response. And the other two wanted to just show you our what the impact looks like on cost for crisis residential. I don't want to spend a lot of time on that. I think you can read that. I know we have very limited time this morning, but be happy to answer any questions that you have. I really would like to focus, because I know there's some other team members who would like to speak as well, on some of the reasons why we're really here today to inform you what's going on. There is a conflict of interest that a PIHP such as OCHN has in becoming a service provider. It is prohibited by the Michigan Department of Health and Human Services RFP process that is underway right now. You can't be both a service provider and a system manager of the mental health providers in your PIHP region. So I don't know how that's going to get resolved if PIHP is both a service provider and a manager, but it is not allowable by the state. The other thing I've heard as a reason for this change, and by the way, OCHN has never provided crisis services in the history of what they used to be as Oakland County Community Mental Health. And so this is a big change, but I've heard, well, there's, statutorily required state-sanctioned crisis provider. Well, I would encourage you to ask for that citation, that mental health code statute, because it doesn't exist. What the statute does say is that the community mental health organization is responsible to make sure that there are crisis services, whether they are contracting them out, fits that, which they have for 35 years with Common Ground, or they could provide them themselves. There's both of those options. So it's not a requirement that OCHN do this, bring in crisis services as far as the statute. The lack of experience and readiness, like I said, they've never done that before. But I really want to talk about, there isn't a transition plan. We received a transition plan, it said that on the header. But a transition is, I define it differently. I define a transition as two parties coming together, making agreements about what is needed, and then working together, collaborating together on that outcome. And that hasn't happened. We received the transition plan that OCHN came up with. It was very much one-sided, no regard for Common Ground in the 35 plus years that we've been delivering the service. But we read it, we discussed it. We came back with 3 high-level must-haves, as we called it, to be able to sit down and work out more of the details. But those 3 must-haves were that Common Ground won't be financially damaged through this process. So that's really important for us. As a nonprofit, we're not that big, and we cannot have major losses because of the transition. It has to be done in such a way that we are able to move the services to OCHN if that's what is in the best interest of the community, but do that without getting financially damaged. The other must-have is that we need to have our administration intact. We estimate 175 staff members will be laid off or off-boarded elsewhere, and that takes a lot. I mean, we've got costs associated with having that transition happen within our own organization. And then the third one was we need to have retention payments to staff to keep them delivering the services while this is going on, because people are leaving, and we have to make sure that the service is available for our community. The response back from OCHN was all 3 were rejected. And so there isn't any place to go from here with a transition plan unless both parties come to the table to work on this, and that hasn't happened. So I'm very concerned about that. I will leave some of the other comments to my colleagues who can talk more about some of these items and give you a sense of really what's happening with the workforce and the people served. Thank you.
Thank you.
Is it time to do that now?
Yeah.
Okay. Sorry. I'm a first timer, so pardon me. I'm here, first of all, I'm Janet Sarkos. I'm the Chief of Operations, which means I oversee all the programming that we do. I'm here to just talk about the disruption in services that I'm already seeing. It's been pretty rough from my perspective. Directly because of the approach I believe that OCHN has taken to this process. It's getting worse each week. I was just in a leadership meeting last week, and I can see the intensity of panic among the leaders of the program setting in week after week. It's getting worse. We frankly have been on a roller coaster. It's been pretty bad. Soon after OCHN first announced their strategic shift in direction back in June, we offered a smooth employee handover, like take it all as a package. We've done this before with our Runaway and Homeless Youth program. We worked with the organization that took all of those programs. We worked with them for a year. Our HR departments were so efficient and smooth and caring about making sure there were no disruptions in services. It was really hard work. It went beautifully. We offered that. They refused. Instead, they've embraced a secrecy as their strategy. For months from June through until the fall, I heard that they had a plan, but they weren't gonna let us see it. So that was just the way it was gonna be. I have been having conversations daily with our employees who don't see their place in the new organization, who don't understand the timing, so they can't make decisions for their families, and who don't see the economics of the change posted. So they don't know what to do. They're feeling paralyzed, but what they're ending up doing is seeking external opportunity. I'm hearing it every day, I'm seeing it every day. Many have stated to me that they don't want to work in this environment that is such a mess. Many others say that they feel like they don't have a choice because they have bills to pay. So the employees are really struggling and suffering, and it's causing service disruption to the people that we serve. Thank you for listening.
Good morning.
Good morning.
I have been a volunteer at Common Ground for 42 years. So every Monday morning at 8 o'clock, I start answering the phones. And I think I've probably talked to over 15,000 people in the time that I've been doing this. Common Ground was founded by volunteers. The spirit of volunteerism invades every part of our value system and every part of what we do. And I think the partnership between volunteers and staff have come up with vibrant programs that answer the needs of the community. We are always there. I'm so proud to be part of an organization that really cares about the people who walk through the doors. And when someone calls me and they say, you know, I need some sort of help, I can say with absolute confidence that if they come into Common Ground or if they use some of the things, the programs that we have, that they will receive care, that they will be treated with dignity, that they will walk away with something better on their journey from crisis to hope. Our programs have been developed over many, many years with a lot of hard work. Years ago, the board decided we wanted to be the Mayo Clinic of crisis care, the very best in the nation. And people still come to us now and they say, can we copy your programs? Can we do what you're doing? And we are so pleased to share that kind of information and to be part of that, making other people's crises better. So to disrupt this is really sad. And to disrupt this when it doesn't necessarily mean that anybody's going to come out in any way better, to me seems like, why is this being done? And so we're here today to make sure that maybe there can be a pause to look at this more carefully, to see that we can keep the things that are really, really good so that people in Oakland County can still get the things that they need, and that their journey from crisis to hope can be the best possible one that they can have. Thank you.
Good morning. As Janet, I am a first timer here too. My name is Cheryl Rivas, and I am here to encourage you again to please take a pause in any service changes until the RFP process has completed. So I'm just here to support Common Ground. Thank you.
Good morning. I'm Vicki Krigner, and I work for Common Ground, but I'm here to support Common Ground, but also to talk about a historical perspective. I worked for Oakland County Community Mental Health Authority when they bid out services for crisis services in, we did the actually RFPs in 1994. And how we did that is we brought the community together. We had stakeholders, we had politicians, we had employees. We actually worked with a group called Rescue out of Toledo. And we all came together to actually talk about what was needed for the community, and came up with the first part, which was the crisis stabilization unit, and then we're building on that with crisis residential, mobile crisis, and things like that. And so I'm asking for the pause, and my pause is the community really needs to speak up and be a part of this, because it's the community who's getting served. And to be able to talk about what's going right, what's going wrong, what are ways we can improve the services, but have the community who will be the ones affected by this change part of the conversation, I think is, it's required. And then knowing that the state is doing the RFP, and once those decisions are made, could also have an impact on who is the PHP. It may not be OCHN. Then who will they contract with for crisis services? They may not choose to contract with Common Ground or Oakland Community Mental Health Services provider, the OCMH or CMHSP. They could choose another provider. So it could be more disruption to the community. So my concern is, again, making sure that the community, who is the one who really needs the services, is taken care of in all of this and isn't forgotten. And I'm afraid that they have been. Thank you.
Sure.
Hello, I'm also a first timer. My name is Lee Schultnover. I'm the Chief Experience Officer at Common Ground. It means I oversee areas of human resources, compliance, quality, process. So you've heard about the disruption to the workforce. According to Michigan Health Council, Michigan is the third worst state for having qualified mental health professionals, right? So people in the state of Michigan with that background, they have a choice. And crisis is hard work, but they're dedicated to our mission. And, you know, we wanna keep them at common ground and help serve the people that are in need. So that's why I'm also asking for a pause. As a resident of Oakland County, I'm also concerned about the stability of crisis services and having a readily high quality service available to fellow residents. Thanks.
Is there any other piece that you'd like to present? If I can open it up for questions also. From my recollection, Common Ground began in 1971. And it was a volunteer organization that came about as a response to what society deemed at that time unsavory characters at Memorial Park in Royal Oak. So that was probably the end of the hippie stage is what I define it as. And then there was another organization called Sanctuary in Royal Oak, which was a runaway children's shelter. So Sanctuary and Common Ground merged, and Common Ground hosted a house for substance use rehabilitation along with the emergency screenings and the kids' runaway shelter. No. Okay, so do you want to come back up for questions?
You want to have?
Yeah, go ahead, John.
Commissioner Powell?
I just had more so a comment, just to let my colleagues know, recently this summer, I had a relative that needed some assistance in the mental health space. I called OCHN, I called Honor, I called Common Ground, and Easter Seals. And all I'm gonna say is, since all y'all in this room, my sister's experience was not that great with her reaching out. She was getting a runaround with, I'm not saying all entities, but she was getting a runaround. But once I came in and I put my title, because I had to put my title on it and I shouldn't have had to do that, things got moving. But the only one that delayed 3.5 months was Easter Seals. She did not get an appointment with Easter Seals to 3.5 months. Now, fast forward, everything is locked in sync now. But I know in this mental health space, we need some changes anyway. So I'm looking to see future, if this transition totally go through, if it not, but I wanna see what is the changes and how we gonna better represent and help our community, because what I experienced and what my sister mental health is right now and what she had to go through to navigate is ridiculous. It's very discouraging and it's very depressing when you going through all that mental health stuff. And my sister got an autistic son. So on top of that, we was trying to get help with that, and we still going through stuff now with that. So all I'm saying is encouraging all parties that deal in the mental health space, we do got work to do collectively. And I had the experiences, so I just wanted to share that experience with all my colleagues and what I recently just went through. So I'm interested to see what this transition gonna be and how everything gonna move forward. Thank you.
Thank you. Commissioner Gershenson?
So I need clarification. One of your must-asks is that Common Ground won't be financially damaged. But if the transition goes through, isn't that the end of Common Ground?
It is not the end of Common Ground. OCHN is about 48% of our funding, so it is a big deal for sure. But we have contracts, we run 988 for the state of Michigan. We have a mobile crisis team in Genesee County. We have a statewide behavioral health urgent care. We have resiliency centers for victims of crime. We have a general crimes team and human trafficking team. So those services make up the other 52%.
Okay, so you're asking that if this portion, this 48% of you is transferred to OCHN, that you will not be damaged financially by losing that 48%?
No, if,
Because that's obvious you will be.
right, that's not what we're talking about, cause you're right, that's a given that 48% is going to be lost.
Right.
It's the costs in transitioning or managing the access of 175 people that has a cost to it. We have costs of unemployment, we have costs of them getting, COBRA, we have costs of bills coming in for insurance companies that are covering us for that time period. We have a healthcare increase that's happening this year. We wanna just make sure that we're not gonna go in the hole. The 48% leaving is one thing, but it's the costs related to the transition, and Vicki would be, as the CFO, would be much better at giving you examples. But offloading employees is not just happen like that and, have costs contained in one day. When you're doing that, they do occur through the course of the entire contract.
Okay, and I can ask further questions with OCHN on that one. What do you mean administration intact? What's the what do you mean by
So Vicki,
that?
do you wanna describe what that looks like?
So the way that our administration works for everybody except for OCHN is 15% of our expenses are covered. OCHN is 12.5%. And what they are projecting in the transition plan that they had submitted, that they were only going to pay 12.5%, and it is only of expenses. So as they offload programs, and we still have administrative costs to help offload those programs as those programs are winding down, are the dollars that we have available for administrative become even less and less and less. So what we were asking for is really just a fixed amount that says, and I'm making this number up, 1.5 million, I think, is what our admin was a few years ago. That, if we have that, for the year, if it's taking a full year for the transition, then let's not do this 12.5% of expenses, let's just do actual cost.
And you're expecting that to come from their general budget?
Like it has always in the past, yeah.
And Marcia, we received a fiscal year 26 contract from OCHN for 1 year, and it was around, I think it was like $516,000. And the contract for 1 year is around $11 million. So there's just no way to make $500,000 for all these crisis services, even though every few months there would be another transition period, is just not, it doesn't pay for services. So I just don't see a success here.
So the board appoints 2 members, is that right, onto the OCHN board? Or
We
have
appoint
more?
we
Oh,
appoint
the entire
everyone on the
board,
board
okay.
of directors of OCHN.
And we rent the property to you that's on the campus for the crisis center, correct?
You lease it to OCHN.
And they lease it to you?
Correct.
So when you're asking us to pause, what power do we have to pause? Where are you seeing that coming from?
Well, the mental health code does give the county board of commissioners powers. Now, I think at minimum, what we would want you to do is to have a public debate on this and host that. This is a really important public policy issue that has not been, really discussed. Last week, I came to the Board of Commissioners meeting, gave public comment. In October, I went to the OCHN board, gave public comment, and I was really surprised to learn that the OCHN board had no idea that this was happening. I was the first one they were hearing it from, which surprised me as well. So it is, I don't think this should be a management decision. I think this is a policy discussion and one that should be had by our public elected officials. in some
And
way.
yet this is a mandate, a state mandate.
No, it is not. It's not. There's nothing in statute that says that a community mental health organization has to be a service provider or crisis service provider. And if you're told that, I would demand to see what, the statute, so that you can see it for yourselves. No, there is no statute that requires that they become a service provider.
Okay, thank you.
I did, after the board meeting last week, I did speak to some OCHN board members who assured me that they voted and understood the direction OCHN was going into with the transition, not the day-to-day activities, because they don't micromanage. So they may not have been aware of job postings, but they were aware of the direction that OCHN is moving to.
They seemed surprised. In fact, 3 of them spoke about that and wanted to know more and said, well, we need to talk about this. We need to have a study session. We need to, not all of them spoke, but 3 board members did. And there was no indication that they knew anything. In fact, they said that they didn't. So I don't.
Commissioner Spiz?
Thank you, Madam Chair. Thank you for coming in. I think we as a board need to decide how involved we want to get into this discussion. For one, I have thousands of questions. I see OCHN is here, but I think we also hold OCHN to hear their side, so bring in the board to have this discussion to understand where we as a board of commissioners want to get involved. But I do have some basic questions. Timing. When is this transition intended to start to take place? Is your contract up at the end of this year? What is the overall start? I mean, because I hear all these transition words being thrown out there, but I still don't understand the timeline of how this is supposed to take place.
So according to the draft plan that we saw, that we said we need these 3 things to be able to get into the details, it starts now.
Like today, it's already in process, is what you're telling me.
Yes, the
Your-
job's posted.
Okay, so your existing contract ends when?
So the contract for last fiscal year ended September 30th.
Okay.
And there is a FY '26 contract that we were sent about 22nd of October that has the $500,000 that I can't sign the contract.
So the previous contract was $11.5 million, I think you said.
Yes.
And the current contract's $500,000. So as of right now, you're not truly under contract.
It
for
goes with the prior year. So for now, that's where we are.
It has a month-to-month extension, that you can go month-to-month in the contract that ended September 30th.
So are you on a month?
So we're still under on that, we're still on
You're on a
that one
month-to-month.
until there's a new one signed.
Okay,
That has been past practice. The 25 contract wasn't signed until September of this year.
okay. That's a different discussion. We have other issues in the same area, so I won't get into that. You mentioned 175 people that are potentially affected by this. Now, you also mentioned 48% is what's funded today through OCHN. Is that 175 only support that 48%, or do they support all your activities?
Just the 48%.
So there would, all right, so that transition. All right, I'm good for now, I got more.
Does a transition include the short-term stay for people?
The crisis residential, it is not in the plan, but OCHN has said publicly recently that their intention is to take all of the crisis services.
Okay, thank you. Commissioner Erickson Galt?
So you're anticipating that with this transition, 175 people will be directly affected, either lose their job or their job will change somehow.
Yes.
You have more than 175 employees?
Yes.
How many total?
We have about 400.
And what other services are you providing other than the ones affected by this transition?
Our largest contract is with the state of Michigan for 988. so Michigan Crisis and Access Line. And you've probably heard about 988, we run that for the state. We have resiliency centers for victims of crime, mass violence events. We have a mobile crisis team in Genesee County, and we have a statewide virtual behavioral health urgent care.
So this proposed transition would eliminate or otherwise affect your sublease of the facility?
Yes, we wouldn't be in the facility any longer.
Okay. And is that the only facility that you have access to?
No, we have the resiliency centers. That is a community-based center where people walk in for services for victim of crime services. And then our mobile crisis team, we have an office in Genesee County. And then the 988 is actually, people can live anywhere in the state of Michigan. We employ people across the state to provide that service, yeah.
And
in our administrative space, that's in Bingham Farms.
and you're offering other services there other than the ones affected by the OCHN contract? Or all the services you offer in there are,
Yes.
so you wouldn't have to necessarily move. You would simply cease to operate there.
You know, we do have equipment
Sure.
and files and things like that.
You wouldn't have to
that we
move
would have to-
operations, it's not like it's not like there's services that you're providing there that have to be moved to a new facility because of loss of the sublease.
But could I say something? I think that what will happen is that you have inexperienced people now trying to run a system that we've spent 30 years developing. And you are going to have a lot of hiccups, to say the least, and even serious disruptions of service. Because, you know, that our staff is not necessarily just all going right over there. It's not like the next morning it wakes up and OCHN is in charge instead of us.
I understand what you're saying about the disruption in service, but I'm trying to understand how the rest of your organization, other than what you've been providing through the OCHN contract, will be affected by this transition.
I think the crisis services, that's a niche. And we have, that is our expertise, that is our niche. We don't do other things that don't involve either individual family crises or community crises. And I think one of the key areas that are affected is we're able at the RCC, the Resource and Crisis Center, because we have victims of crime services. It is really seamless and nice for people who are receiving crisis services, who many of whom are a victim of crime as well, whether it's sexual assault, whether it's domestic violence, whether it's any kind of assault. And our victim services staff can help that person at the same time as they're getting their crisis services. And that's really unfortunate that won't be readily available. I think the other thing that we're gonna have to figure out how to do is we're gonna have to shrink our administration drastically, and losing 12.5%. And and by the way, I've also heard that OCHN would say, well, our administrative rate is only 6% and yours is 12.5%. Well, you're a $460 million organization. Of course it's gonna be lower. You don't need $35 million of your administration to operate. But for an $11 million contract, you have all of the requirements that OCHN has of their huge providers. We have the same level of responsibility, and so it's when you boil it down to what does this really look like? It's when you consider equipment and fringe benefits and et cetera, it's like 11 people. That's it for our administration for the OCHN contract. And let me tell you, there's a lot more work from more people than what we're funded by them to do. They have definitely have they're a high utilizer of our administrative functions and staff. So it will affect other programs or other funders in the way that we're gonna be a much smaller organization overall.
I would also add that our programming is set up as a continuum, meaning that there is no wrong door at Common Ground. If you show up one place, we're gonna get you to the place that you need to be. And so to your question, Commissioner, about the other programming that will still exist by Common Ground, there are referrals that go into the OCHN funded programs from those programs. And so we're not quite sure how that's gonna work in the distant future.
Commissioner Spiz.
Thank you, Madam Chair. I don't think we're gonna solve this today. But I think we owe it to both OCHN, Common Ground, and especially all the citizens that are involved with any type of mental health or crisis intervention at this point, that we need to have a deeper dive, especially into any said transition plan. Because that is the meat and the potatoes is the way I look at it. If this is going to take place and we're gonna, and OCHN is truly gonna bring it inside, the transition plan is critical, and especially after Commissioner Powell's comments, we have to make sure that's successful and has to be dot their i's and cross our t's. And that's where I think we as board of commissioners need to get involved, is any said transition plan. Now, we can have further discussions after that, but to me, transition plan is the center of everything right now. That's just my thought. So I'll leave it to chair, because I like to bring OCHN in and their board to have a similar discussion like this. And let's focus on that transition plan.
Thank you. Commissioner Gershenson.
And just for clarification, when you said that OCHN was going to take your crisis phone line,
That's what they want.
is that the 988?
No,
No, so you have a separate one, so you
Correct.
still have the contract for 988.
yes.
Yes.
Okay, thank you.
All right, thank you.
Thank you.
Thank you. All right, we've heard a lot of information, so Anita, we have literature, the two pieces of information to file and receive.
Move to receive and file.
Thank you. Support from Commissioner Erickson Galt. In favor say aye.
Aye.
Opposed? All right, information is received and filed. We move to Health and Human Services recommendations. We have 2 items. The first is a grant acceptance for the fiscal year 2026 Pontiac Integrated Urgent Care Grant, and the second is an amendment to the Ballmer Group for supporting community schools with Oakland County's Transition to Success program, the Southfield School District. And they have a motion by Commissioner Spiz, support from Commissioner Taylor, and we have Leanne Stafford here to address these 2 items.
Good morning, everyone. So the first item here is just a continuation of the funding that we received from the state about 4 years ago to create the Integrated Urgent Care, or what we call is the Oakland Community Care 360 Care Center, which we launched and did the ribbon cutting about a month ago in downtown Pontiac. So we were lucky enough to work with the state so we could use this funding to continue through fiscal year 26 to continue to support staffing, as well as, some equipment for OCHN, Honor Community Health, as well as ULSA, which is helping us support those activities there. I'll stop there. We're rolling over $990,000 for that.
Thank you. Any questions regarding that particular item?
Nope.
All right, moving on.
All right, so the next one, I know we brought this a couple months ago, which is our Ballmer grant, which is really focused on bringing wraparound services to Southfield School District as well as Hazel Park School District. And so what we're asking for is to take the part-time data analyst and actually make it a full-time data analyst. The money is available in the grant funding that we received all 3 years. We feel strongly that starting from the beginning, we need to gather the data, right, as we really start to look at sustainability of this project. And so we feel strongly with the 2 school districts and the amount of data that's going to come out of there that we need a full-time person. So asking to upgrade that to a full-time person.
Thank you. Comments or questions? Would you prompt the vote, please?
You have 6 yeas and 0 nays.
Motion carries, thank you.
Thanks, everyone.
Thank you. Our next item is from the prosecutor's office. It's a grant acceptance from the Michigan Department of Health and Human Services for fiscal year 2026 Crime Victims' Rights Program. Who would like to make a motion? I have a motion by Commissioner Taylor, support from Commissioner Spiss. And we have is Mary Larkin here?
She's on
Yes.
mic.
Hi, good morning, yes. For some reason, my camera will not turn on, I apologize.
Good
Can
morning.
you hear me?
Yes.
Yes.
Okay, great, thank you. This is our request for the board's approval. This is the 34th year of this grant through MDHHS for our Crime Victim Services Program. And it funds 5 full-time victim advocate positions, and it also funds a full-time support staff person and my position as the leader of the Victim Services Division. This grant enables us to provide the services that we are mandated to by the Michigan Crime Victim Rights Act. And that primarily consists of notifying victims of what's happening in their case, as well as accompanying them to court, keeping them updated, and explaining very complex legal procedures so that it is as smooth as possible for them going through the court system. I'm happy to answer any questions that you may have. Appreciate your consideration.
Thank you. Any questions or comments? Well, after 34 years, we're happy to continue this.
No.
Would you?
Thank you, we appreciate it.
You have 6 yeas and 0 nays.
Motion carries, thank you.
Thank you for your consideration.
Our next 4 items are from the Sheriff's Office. 3 are grant acceptances. The first from the Federal Bureau of Alcohol, Tobacco, Firearms, and Explosives for the 2026 Overtime Reimbursement Funds. The next is from the Department of Health and Human Services for the Anti-Terrorism Emergency Assistance Program. The third grant acceptance is from the Michigan Department of Natural Resources for the 2026 Off-Road Vehicle Law Enforcement Program. And the last is an amendment to the 2025 Law Enforcement Distribution Program from the Michigan Commission on Law Enforcement Standards. I have a motion from Commissioner Powell and support from Commissioner Erickson Galt. So I'm welcome to talk about these items, but first, do you have a question?
Yes, Chair, can we do A through C together and then D, because it's an amendment? If you grant, or if we decide that, can we do that all together?
Sure.
Okay.
Sure.
Thank you.
Good morning.
Good morning.
So the first item is an annual notification of our limits for overtime reimbursement. We had a couple at the last meeting for the Joint Terrorism Task Force and another task force. This one is actually for the alcohol, tobacco, firearm, otherwise known as the ATF with the federal government. They're giving us $22,155 per task force officer. And this year we have an estimated 5 task force officers assigned to the unit. And then there's also funding in there for 1 additional if they need assistance on cases. So that total is $132,931. The next one is the final extension of our AEAP Anti-Terrorism Emergency Assistance Program grant. This funds 2 full-time Deputy 2 positions with no required match. The total is $344,602. This is the final phase of the post-Oxford funding through the state. And then the next one, I know we have Jim Levy here from Parks and Rec.
I don't know if there's any, but we love having the Oakland County Sheriff at the ORV park. And it's huge to have them there it kind of helps have them there if there's incidents or accidents, that they're right on the scene. And we greatly appreciate the grant and having them there on site.
Thank you.
It's a great program for us.
Yeah, so this is the 7th year of funding, so we get about, I think it's 12,560 and it's for patrols at the ORV park. So it's a great partnership with Parks. And then our last item is through the Michigan Commission on Law Enforcement Standards. So each year, did you?
Want to do them separate, right?
Are you doing this one separate?
Yeah.
Oh, sorry.
Okay, any questions on the first 3 items? Would you prompt the vote?
Good having good money. losing ground today.
You have 6 yays and 0 nays.
First three items are approved. Let's hear about the fourth.
Okay, so this is every year we get 2 distributions from the Michigan Commission on Law Enforcement Standards. And it's for our training unit. So the second, we had the first distribution to you earlier this year. This is the second distribution in a little over 129,000 for a grand total for 2025 of 236,526.95.
Okay, so we separated the items, so we have a motion from Commissioner Powell and support from Commissioner Spiz for this.
Okay.
So, questions regarding this item, Commissioner Powell? No? Okay. Any other questions?
No.
I think the co-responder program is necessary, needed, and there's no grant match here, and I'm just glad to say it again.
No, you're on D, that's not co-responder,
Oh, the co-responder.
that's next.
Oh,
Yeah. But
you are
we're
correct.
on D.
You are correct. Okay, any questions regarding D with our 7th year of funding? All right, would you prompt the vote?
You have 6 yays and 0 nays.
Motion carries. All right, our last scheduled item on the agenda is an amendment to the Oakland County Co-Responder Community Grant Program Agreement. So I have a motion by Commissioner Spiz, vote from Commissioner Powell, and our very famous Michael Andrews to talk about this.
Thank you for that previous ringing endorsement of the program.
We're done right now.
So I'll go ahead and introduce yourself.
Tricia Zizambo, Chief Operating Officer for Oakland Community Health Network.
And so this is an amendment to an agreement that we have with OCHN. The board has separate from the Sheriff's Office agreement that provides essentially the same services, but this is more specialized to certain communities within Oakland County. And it continues, or is funding that will continue to sustain it for an additional year from the previous allocation from ARPA funds, but this is more general fund side of it. So just wanted to make sure that that was clear because we want to make sure that, number one, there is a separate understanding that, once the ARPA funds are used up by the end of 2026, that this will essentially sustain the program until those local communities can find the money within their budgets to keep those co-responders within the community, so.
Commissioner Powell?
I am a champion of co-responders. The OCHN know, everybody know, this has tremendously helped the city of Pontiac, and I know countywide, but I've been watching the action in Pontiac. So whatever commissioners we need to do to keep all our co-responders throughout Oakland County going, this is a program we need to keep in place. So I encourage you all to let's keep this momentum and these co-responders out there because they're helping our people. So thank you.
Thank you. Commissioner Gershenson?
I also agree, but I'm looking, which communities are you talking about?
This is Madison Heights, Royal Oak, Ferndale, and Hazel Park.
They
We
share
initially received the funding through our ARPA funds. That year of funding ended in July based on the co-responders that we have. And so this will sustain them for this fiscal year, starting in 10/1 through the end of September.
Those 4 communities share one?
Share 2 co-responders.
Share 2.
Yep. We have a total of 22 communities now with about to hire our 12th co-responder.
Okay, thank you.
Commissioner Erickson Galt?
Thank you, Chair. I champion this program for obvious reasons, but also that it's providing a necessary service for communities that would be struggling to come up with the funding at this time. And so the idea is not to necessarily fund it in perpetuity, but to give them a longer runway in terms of determining how. And I know for a fact that one or more of these communities would have to drop their co-responder program if they didn't have this additional funding. So it's critical to keep it going. One question I had, and when we were working on this in the budget process, it wasn't clear to me whether we had exhausted all of the ARPA funds yet. do we have an accounting for how much of the ARPA funds have been spent, and how much we have left?
I can get you the exact number as of today, but we are slated to expend them by the end of the September 30th for the fiscal year. Each contract that we have with the communities receive 12 months of funding for the co-responders. So depending on when they started, depending on when the co-responders were hired, each community is on a different track. But they receive the 12 months, and part of the stipulation in the resolution was that they have a sustainability plan of having it approved through their city council to sustain funding there and after. So we do explore grants with them. We have a few communities that use opioid settlement funds to pay for this. But it is baked in that they should have a sustainability plan moving forward.
I think in addition, OCHN does do a good job of reporting back to the board, to this body, and this committee, their expenditure of the funds and where it goes and what communities it's impacting.
Okay, great, thank you.
Commissioner Spence.
Thank you, Madam Chair. A couple questions. One, I don't think this is political in any way. So I think it's, bipartisan, 100%. We all support this program. We think it's great. We want to continue to grow it. So I'm glad to hear you say that you keep asking about sustainability. How many communities out there are we believe are concerned with being able to maintain this after this money runs out?
We know of one currently. All the others have approval through their city councils to sustain that funding. We've had some that have opted out of even receiving the ARPA funds because it's already something that's built into their budget with their city, village, or township.
Beautiful. Now, how do we expand it to all the communities within the county?
I have worked on all my relationships with all my police chiefs, and so we are continuously meeting with them. My actual police chiefs and the sheriff's office are probably one of our biggest proponents of this program. So out of the 43 police departments we have, we are soon to be in 22. We're adding 5 new communities with the ARPA funds that we currently have. And so obviously finding clinicians, having a supervisor over that, we are expanding with some peers as well. So we continue to meet with those chiefs that do not have a program. Sometimes it usually is a funding and sustainability. They have lower numbers. So we do work with them to partner. So for this case with the 4 communities, we have other communities that have partnered. So Walled Lake, Wixom, Wolverine Lake, and White Lake have partnered together. West Bloomfield, Sylvan Lake, those areas, they've all come together. Our original 4, Auburn Hills, Rochester, Birmingham, Bloomfield have, so we do try to facilitate those relationships as well. For example, I've had conversations with Chief Boss in Clawson, and while she knows she can't sustain or have the numbers or the data to support a full-time, we've discussed how we can partner maybe with Berkeley or with Troy and increasing that. So we are having those ongoing conversations and then being able to utilize grant funds, opioid funds, if we don't have other funds to use.
Thank you for that. Let us know how we can help.
Absolutely.
Commissioner Powell.
And I know we had some concerns because in Pontiac, and we were trying to seek a second one. Just when you get a chance, not for conversation now, just give me an update later on where we at with that. Yeah, thank you.
Any other comments or questions? Would you prompt the vote? One of my kids.
Some of the Jeopardy thing.
Slow down.
6 yeas and 0 nays.
All right, motion carries, thank you. We are now at public comment. This is for any items. So anybody from the public would come to the head of the table, state their name and community, and you have 3 minutes.
I'm going. A few of you heard me before at the other meeting. This is a really serious problem. The Zoom hearing platform has been made without security and safeguards to preserve and protect the court records. They're using it as an instrument to deliver predetermined cases, to control the narrative, control the court records, control everything about the case, so a litigant like me cannot fight back being pro se. I have 5 Zoom hearing records that were corrupted. After the first one, 4 of them I can prove with irrefutable titanium evidence that only my statements were removed. Nobody else's were affected, almost 90 of them. In the same court, they removed it to take away my parenting and custody rights. They try to control the false narrative by taking out the statement to say, oh, she's crazy or she's whatever it is. The bottom line is,
I've had the Michigan Supreme Court complaint for superintendent control. I went all the way up to the point of asking, hey, did you give my report to the Supreme Court justices? Because I know Justices Viviano, Zara, and Bernstein all did not like the Zoom hearing platform because of the security issues. Former Supreme Court Justice David Viviano retired because of the direction of the Supreme Court, direction of the State Court Administrative Office, and that there should not be any Zoom hearing. I asked him this February. He dropped off files. He didn't want to comment, but he did call me back to find out what I was going to talk about. I figured I had 5 minutes. I got 15. All I wanted to know, did you receive my report? Because it showed that the top administrator of SCAO, which is Tom Boyd, and his regional director concealed information. They suppressed it. They worked together to say no second report was filed, but it was. I have email evidence. When the superintendent complaint went to the Supreme Court, it forced Tom Boyd to answer, hey, did you receive a second complaint? He walked backwards and he goes, yeah, I sure did. But it was so much like the first one, I closed it. He closed it within 24 hours of me filing it on March 9th. In cahoots with the court here saying, hey, we closed your file, same day. Then they told me I had a protective order against my evidence from sharing it with anybody, from talking about it or disseminating it. Why? It's because there is no security. There are no secures. Oakland County bought the Zoom license and the Zoom technology for these judges to use. And you guys cannot allow, just because they're from the judiciary, oh, we can't touch them, we can't talk to them, that's their thing. They're the ones that are doing it. Everybody has concealed, suppressed all the evidence. Judge Langton made comments on record that were removed. So the arbitrator altered emails to invalidate. Big deal, Ms. Gupta. And I said, it is a big deal. Let me explain why. All of that conversation was removed from the May 22nd or 25th, 2022 hearing. The arbitrator altered emails. He's a very well-established arbitrator. He doesn't even have certification to be arbitrating and mediating cases here. I just want Oakland County to be aware because I am following all this up.
Thank you. Excuse me, ma'am, what's your name?
My name's Marguerite Gupta.
And you're from what community?
Oakland Township. My background's engineering and science.
Okay,
And I have completely been legally, totally abused in this system.
Okay.
But the biggest part is, the truth never lies. And for everybody that's been involved, not one court officer from the Attorney General's office, State Court Administrative Office, why? Because there's so much interwoven. Everybody does their tenure at the State Court Administrative Office, gets a job at the Attorney General's office. The two Deputy Attorney Generals, Mr. Joe Pochin and Peter Manning, or Paul Manning is it? They started at the same time Tom Boyd started. They all protect each other. Tom Boyd should have never been giving any counsel for superintendent control complaint filed with the Michigan Supreme Court. That's violating Attorney General's policies.
Thank you.
Thank you.
Is there anyone else for public comment?
Hi there, Matt Tanaskis, private citizen, former commissioner myself. And I thank you all for that wonderful conversation you've been having here about common ground. And I just had to share a few real reflections. You know, as we sit around this table and it's a great discussion, I also kind of reflect, today's election day. As you look at election day and you see a candidate and ask a candidate, why are you running? You know, if that candidate nails it, you know that candidate's got a plan of where they're going and et cetera. We look at here today, has the why ever been asked? Why are we doing this? Why? This, I think, it will probably be the 5th or 6th service that OCHM is now taking in-house. Maybe that's good, maybe that's bad, but why? Have we looked and asked the number one question, what's the effect on patients? I love it, Penny, when you talked about the history of Common Ground. It was, Tony came from my hometown of Lake Orion. You know, one of the innovations was passing out simple business cards. Call the suicide helpline. Volunteers. Our own Sheriff Bashar was one of the volunteers. There's been thousands of high school volunteers over the years with Common Ground. So we're gonna eliminate, the question was asked, are you eliminating Common Ground? Yeah, that pretty much you are, because you have the 911, which is the state contract, you're down to just a very few services. And what about all those innovations that take place from a nonprofit that's been around for 55 years? Why? How are they going to replace that? What's the value of those volunteer hours? What's the value of hard dollars coming in from donations from all those people and goodwill for 55 years? Why are we doing this? What's the policy? And you go a step further. Your responsibility as a board member. Yes, you appoint them to the OCHM board, and you expect them to do their job. And their job is fiscal responsibility and setting policy. Has a policy been set on this? No. As an elected official, what do we hear about for years? Transparency, openness, not letting an administration just make their own decision in darkness. At least demand your board members have some public hearings, set the policy. What is the 5-year plan? Is it purely because OCHM needs to have relevancy? Because we don't know about what's happening at the state and federal level. So grasping for survival, they're taking services in-house. Okay, that might be good for them, but let's go back to the patient. Patient. When we look at the transition and all the whatever, what's the cost? We know that they asked for $2.5 million in the state budget. We know they knocked on your doors for more money. Woohoo! So they can provide crisis services where they don't have expertise. It's gonna cost more money. Those extra dollars, how does it help the patient? Why? How is it helping the patient? Simply ask your appointees, their administration, to do the job. We want the fiscal layout. How much is this gonna cost? What's the plan? What's the 5-year vision? Are you going to be the sole provider of mental health services in Oakland County? What's the next service you're taking up? We haven't even mentioned the thing that's in New Oakland that's being absorbed as well. That's another nonprofit agency that will go out. A large part of their business will go out. So 5th or 6th thing that's being absorbed inside. Maybe that's the greatest policy in the world. Well, what's the efficiency? How does it affect the patient? Please, consider passing a resolution. Stop. Let's look at all the factors. Have some public hearing. Have some real dialogue about it. Thank you all. Thank you for your time. Appreciate it. Don't forget to vote today, right?
Right.
All right. Thank you.
Anyone else for public comment? All right, public comment is closed. We have other business. Commissioner Powell.
So I just wanted to ask Chair, today we've been given a presentation from Common Ground. When are we going to allow OCHN the opportunity to address us in regards to this matter? Because I do understand that our governance and how we can intervene, we're still trying to get information to understand that process, right? So I just wanted to know, when will we hear from the other side? And then I guess however commissioners can get involved or whatever, we'll decide how we proceed. You may have answered it. I'm sorry if I'm asking a redundant question, but I just wanted to know, Chair, your thoughts on.
Well, we've had a lot of information today about what's going on in the transition. So we do need to offer the opportunity to OCHN at our next meeting if they're available.
Okay, I do understand things are moving a little swiftly. Is there any concerns in OCHN's movement and their time and us trying to coordinate that? So we kind of stay ahead of power moves and we don't know about them, or Is that gonna be looked at their
Our
timeline, I guess?
responsibility with OCHN is appointing board members. Historically, we haven't micromanaged what contracts and things are going on. So I will echo Commissioner Spiz's words, is how much do we get into the weeds, or is it our responsibility?
Thinking the same, yeah, okay, got it. Okay, thank you, Chair. Thank you for that clarity, and I'm just looking forward to hearing from OCHN in this matter. Thank you.
Commissioner Gershenson?
So I'm looking, and the next LAGO meeting is December 2nd.
PHS.
I'm sorry, yeah, PHS. So
Same.
what is the deadline for this?
Yeah, that's too
Is there a
long.
deadline for this, us to weigh in on this, or?
Well, this information is as new to me as it is to you, so I don't have that question, but I go back into how much are we involved in the micromanagement?
But that's one of the reasons I asked my question about timing.
Right.
And they're month to month at this point, which I will assume they'll continue month to month, because I believe Common Ground's not gonna sign that contract for $569,000, right? So they're gonna continue to be month to month, so, but I think timing is critical, we don't need to punt, we need to continue to push.
Yeah, so if we hear from them on the
I mean,
second,
Or no, our
we
board
only
meeting.
have one more board meeting on the 11th.
I would be open if OCHN is also open
Our board meeting.
next
Well, I
week,
see
do a pre-meeting between our board
OCHN in
meeting next
the
week.
room, which
I know, I didn't want to put
would
the spot.
we be able to put you on the spot, Trish and Dana?
Dana's actually on the agenda at the board meeting next week, so I think that might be a
Oh,
perfect time
perfect.
for us to provide that.
Cause we'll be able to Q&A then. Okay.
Yeah.
I don't know if you wanna do it on the board floor, or do you wanna have a pre-session PHNS to have that meeting with this group, so.
Well, don't you think the whole board should hear it?
No,
I didn't
he's
hear the
saying
other-
having a
didn't hear the other one.
pre-meeting
Oh.
before PHS, we talk about it and then they
Okay.
still do a presentation.
Yeah.
That's correct.
We don't have a decision to
We'll
make.
take it under consideration
Yes.
and let you know.
Right now, we just hearing them out. No, we don't have a
Right.
decision at this
Right,
point, cause
so-
we still trying to understand what our teeth in this is anyway,
Right.
right?
So I don't understand why we would need to have a
Pre,
PHS meeting
Mhm.
beforehand.
got it, okay.
We just hear the same thing twice.
Well, I'm not sure we hear the same thing twice, because I'm sure we're gonna have a lot more questions
Yeah,
for
then on that
OCHN than
floor.
we're gonna have on the floor based on Dave's presentation. I'm sure it's just a quarterly update
Yes.
on the floor. It's a quarterly update of all OCHN on the floor
Well,
versus just
quarterly
this topic.
update incorporating common ground concern.
I'm sure that's
Oh, I
one
thought-
piece
yeah.
of it, but
I just wanted to
I
make
would
sure that
think
was
we
clear.
would wanna have a pre-meeting to have a more in-depth discussion
But
about
didn't,
that.
I wasn't at the last board meeting, but didn't both Common Ground
No.
and OCHN speak?
No,
Okay, just
Just public
Common
comment.
yeah, it
Ground,
was just public comment.
It's just
but
general.
OCHN was included in
made a
the
comment.
public
Yes.
comment.
Dana made a comment.
Yeah,
Just
Yeah.
public comment, but I don't,
But
it doesn't
that
give us
wasn't-
yeah, I
anything to
get
talk.
it.
No
My
Q&A.
recommendation is to have a pre-meeting, that's me.
Okay, we'll just let you decide, but thank you.
Thank you.
Unless you cheerful, she let us know what she decide.
Any other business?
No.
All right, the committee is adjourned at 11:43.
I just.
Sure.